Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron is not with us today. By the way, happy birthday and congratulations to his daughter Miranda on scoring an internship at Senator Duckworth's office. Hooah!
And I'm Jean Marie. Just a word of caution before we start today's episode. We may be using some adult language during the course of this show, and this episode may not be suitable for all ages, and some may find this episode or parts of it offensive. They might always find us offensive.
Wow.
Just listen to another podcast.
This is what we do when Ron's not here?
Yeah. We go all out.
Okay, well now I'm curious. What the heck are we talking about? Anyway, collectively we're the hosts of PodcastDX. On today's show, we are talking about neurotoxins. In particular, we are talking about botulinum. Is that how you say it?
Botulinum.
Botulinum toxin type A, an injectable neurotoxin.
This particular type of bacteria known as Clostridium botulinum produces a number of toxins, 8 that are classified as exotoxins, and these can result in the paralysis of muscular tissue in humans and animals. In nature, these toxins can also result in death, and in fact, you will hear about it occasionally, things that if someone cans items improperly or other issues creep up, then, there's a reason why there's that little pop-up. If something's popped, like your jar, or, you don't want to eat whatever.
Oh, yeah, the little indent on the top of the jars when you can something?
Yeah, or when you get like a jar of pickles.
Okay.
If you're at the grocery store and a can looks like it's ready to explode,
don't
eat it. Yeah, don't
even
eat it.
If it's free.
Yeah, don't eat it. Okay. However, botulinum toxin type A can be refined and safely used by qualified healthcare providers to treat a wide range of medical conditions. Although there are still potential risks and life-threatening side effects, Botox has been known to cause muscular weakness, vision problems, as well as breathing and swallowing issues for which you should seek immediate medical care. It's vital that if you are receiving Botox injections or other neurotoxin injections, that it's from a licensed and well-trained healthcare provider with a detailed knowledge of the musculature and vascular structures in the area to be treated. There are a number of conditions for which Botox is not recommended, and your healthcare provider should be well-versed on your overall medical or state of health, and any conditions that you might have or medications that you are taking which may preclude you from getting Botox or other neurotoxin injections. You must carefully follow your healthcare provider's aftercare instructions as well, and I guess I need more coffee.
Okay, well, you work on the coffee.
Okay.
Botox, it's a brand name, and it's a brand of injectable neurotoxins, probably best known for its use in treating cosmetic concerns. For example, it's often used to relax the muscles in the face and neck that cause wrinkles. I would have thought that relaxing them would cause wrinkles.
No, if you think about like when your face wrinkles, it's because you're scrunching up your muscles.
Okay. Well, that surprised me.
Okay.
It might surprise you what else it's used for also.
Right. The first time I actually received a shot of Botox was at my proctologist's office. He said that it was a good non-surgical way to treat anal fissures. And he also mentioned that his wife wanted Botox injections in her face. So if I would be so kind as to come to the office when she was free, she would be there as well, and we could split the cost of a vial.
So he injected your ass and then her face?
Yeah, although I think he used different syringes. I'm pretty sure he used different syringes.
Okay.
Yep. Okay. So anyway, now that everyone is cringing.
Yeah, I'm cringing.
Yeah, and maybe some muscles are a little bit puckered. I also know a bit more about Botox and its use to help treat migraines.
Right.
What other medical uses are there for neurotoxins?
Some healthcare providers have used Botox to treat a wide range of conditions. In the U.S., it is U.S. FDA approved to treat chronic migraines in adults, cervical dystonia, excessive sweating, overactive bladder, strabismus, urinary incontinence, and spasticity.
And actually it was first used for strabismus by an ophthalmologist, and then he sold the company some of his patients had noticed that their wrinkles were also reduced when he gave them the injections.
Okay. There are countless other potential uses for such treatments. In the U.S., any off-label or non-FDA approved uses will not likely be covered by medical insurance. Currently, there are clinical studies underway to see if Botox can help treat depression. Depression?
Yeah, there's a theory that if
your muscles are tight?
No, it relaxes your muscles.
I know.
So if you are, because like I have like frown lines.
Yeah.
Because from always being in pain. So if they relax those and I can't frown, I might not be as sad. And also, just looking in the mirror, I won't see the sad face. So maybe I won't feel as depressed. It's
okay. All right.
It's being tested, and it's had some success, but it's being tested.
Other clinical studies are for premature ejaculation, painful pelvic floor contractions during sexual intercourse, abnormal heartbeat, cold hands as a part of surgical
and
as a part of surgical procedures, allowing areas to heal post-operatively without overt muscle contraction in the area being repaired.
And we have some typos on our script today. Sorry,
That's
folks.
Okay.
But yeah, so if you can't tighten up that area, it'll be relaxed while it's healing for about 3 months.
Okay.
And you might not get as much of a scar. I know they're using it like in cleft lip treatments for babies.
Okay.
But anything that's considered an off-label use cannot be. They can't advertise for it, and doctors should not be telling other doctors about it until the clinical results are in. And I get Botox injections quarterly for migraines. And as you were saying, healthcare providers may treat several conditions using Botox,
right,
and that brand of neurotoxin.
And you've had success with your Botox injections for migraines, haven't you?
Yes. It's actually funny because I don't really know how effective the injections are until it starts to wear off.
Uh-huh.
So for 3 or so months after a batch of about 30 injections, so it's not like an easy fun day at the doctor. They're giving you injections all over in your hairline, depending on where you need it, specifically in the TMJ area, in the trapezius muscle, so where you specifically need it, and that's why your doctor really needs to know you and what they're treating you for. But when it starts to wear off, I'm back to having migraines every single day, and they're really bad. And I actually see a neurologist for my Botox for migraine injections, and she's a migraine headache specialist, a neurologist, as I said, and she has an extensive knowledge of migraine treatments, especially Botox, and its uses and limitations. So when I have like a odd, weird migraine symptom, she's the one that I go to, and we've been talking about surgical interventions for treating my migraines because you can actually develop a resistance to Botox over time, and then it'll no longer be effective. Although there is a new variation of Botox for which people aren't producing antibodies as quickly. So that might be another option for people for whom Botox was no longer effective.
Okay. Speaking of antibodies, so in other words, if somebody gets Botox regularly, they might not be affected like that Russian spy was when they injected him.
That's like people like you read about okay.
Maybe people get immune.
No, you build up immunity things, but don't start getting extra Botox injections to prevent,
being poisoned?
Yeah, it's not, no.
All right.
Okay.
Well.
Sorry for getting way off topic.
Well, no, it wasn't really. I mean,
Okay.
It's a neurotoxin.
Yeah.
Well, Jean, what additional tips, hints, and advice do you have for somebody that's considering Botox for migraines?
If you're going to be getting neurotoxins, as we said before, make sure your doctor is qualified, knows you, your medical conditions, any medications that you're taking, does a thorough background on you, and finds that you're the correct, or a good candidate, not correct, a good candidate for Botox. And when you're getting your injections, try to just stay relaxed. If your muscles tighten up, you might get a tension headache. I've heard of many people doing that, so try to just relax and breathe while you're getting your injections. And if you're sensitive to needles, or you're afraid of needles, then you can actually ask for your doctor, and they can prescribe a topical analgesic that you can apply to the area that you're going to be getting injections in, and let your doctor know if you're taking any blood thinners. And then also you might want to apply an ice pack to the area afterwards to prevent bruising, and follow any aftercare instructions that they give you.
Okay.
Like I think I'm not supposed to lie down afterwards because there's a chance that the Botox can leach to other areas.
Okay.
Yep.
I didn't know that.
Mm-hmm.
Well, I think that's it for Botox for migraines. We're going to be talking more about surgery or cosmetic
non-surgical treatments.
Yes, there you go.
Cosmetic treatments such as sugar threads and Botox and fillers.
Right. So we'll be talking about that in a couple of weeks. Mm-hmm. But for migraines, that wraps it up.
And there are many other, potential
uses
for it, and always just make sure that you're talking things over with your doctor or other qualified healthcare provider.
Okay. And if our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you'd like to comment on the fact that we both just did a podcast after having dental procedures, please give us a review wherever you get your podcast. And as always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking because of something you've heard in this podcast.
Till next week.